That's always how I'm always a mess in the first like few minutes. I get like anxiety or nervous or whatever this is. I don't know.
That's what editing's for, right?
Yeah.
Absolutely.
Hey TID fam, welcome to season 2 of the Invisible Diaries. We're your hosts, Misty and Amber. I'm Misty from MistyBlueDream.com, a chronic illness lifer with Ehlers-Danlos syndrome and a congenital heart warrior. I am a biomedical major, writer, mom, and advocate.
And I'm Amber from the autoimmuneadvocate.com. I'm a mom, health coach, advocate, and fellow chronic illness warrior. And together we created the Invisible Diaries to shed light on invisible and chronic illnesses through education, advocacy, and awareness.
The Invisible Diaries isn't just about sharing our story, but also including each and every one of yours. But first, a quick disclaimer. Any information discussed in this podcast is strictly our opinion and for informational purposes only. It is not meant as medical advice and should not be taken that way. Always consult with your doctor or medical team.
We know battling chronic illness can be hard, and if you find yourself or someone you love in crisis and need someone to talk to, you can call the National Suicide Support Lifeline at 1-800-273-TALK, which provides free and confidential support in the U.S. 24 hours a day, 7 days a week. Again, that number is 1-800-273-TALK.
Any cited resources mentioned will be linked on our website, theinvisibleidiaries.com. Now let's get started.
So we're a really kind of special place because it's one of the very few places where you can go and have imaging done and see a breast surgeon and get a biopsy and get radiation planning and treatment planning. And we have counseling that we can refer people out to. So yeah, and it's like a spa environment. We also have a cosmetic side. So it's a really, really different experience because there's chandeliers and big fluffy chairs and,
it lightens the vibe, like when you're dealing with scary stuff like that. I love that. Meghan Schultz, RTRMBD, graduated from the radiology program at Eastern Florida State College in 2010 and has been practicing in Brevard ever since. She holds federal registries in radiology, mammography, and bone densitometry. Okay, go ahead.
Densitometry.
It's a tricky one. She has helped implement the first 3D mammography system here in Brevard County and recently helped upgrade the current facility to 3D mammography with current curve technology and 3D biopsy ability.
Meghan, thank you so much for joining us today. Please say hello and introduce yourself, and also tell us what all those letters mean after your name.
Hi there, I am Meghan Schultz, and the letters simply mean that I'm specialized into breast imaging and into bone health. So mammography gives the ability for us to do breast-specific radiography exams. Mammography is a screening tool and also a diagnostic tool for women and men. And bone densitometry is what people refer to as a DEXA scan, where you come in to have your typical bone health checked. So the letters just mean that I am federally registered and able to perform those examinations.
And awesome.
Oh, why, thank you.
So October is Breast Cancer Awareness Month, and we're really excited to have you here with us. I know you're very knowledgeable in this topic with your background and experience. What information can you share about breast health? As in, like, what age should we start self-checking? What do we look for when we self-check? And then how often should we get a breast exam? Give us all the good details.
Okay, so to summarize, it's knowing your body. So for breast self-exam, so self-breast exam is what you do at home when you use your hands or your eyes to take a look at your breasts as they should be. So men and women should perform monthly self-breast exams. The general recommendation is to start at the age of 18. I, however, encourage it from the onset of puberty so that teenagers can learn what their normal is, even as it changes, while they're still home with support with a parent, as some teens will naturally feel lumps. Many women with fibrocystic breasts will also feel lumpy. This is why we suggest self-breast exam to be done around the same week of the month usually directly after your cycle, so that you can learn what your normal is and look for those changes. The changes can be not only felt, but sometimes just looking at yourself is a huge tool. So stand in front of the mirror, put your arms over your head, look at your breasts, look for skin changes, dimpling in the skin, changes in the shape of your breasts. Anything that is out of the norm to you means that it's enough for you to talk to someone about.
I love that you
Wow.
say that, because I think we miss that a lot in healthcare, which is what's your normal, because we're so different.
Yes.
So what a great tip first. I mean, just to be able to say, like, get to know what your normal is.
Yes.
And then, second of all, if it's outside of your normal, once you get to know yourself, that's when it's time for you to maybe ask some questions with the right professionals. So that's such a great tip.
Absolutely.
Yes. And I did have a question too. I don't know if you know or not, but I know we discussed, men to do the self-check as well.
Mhm.
Even though statistically it's higher in women. What would you say? Do you happen to know offhand how often men get breast cancer?
Well, it's a lot more rare in men than women. Being female is the number one risk factor for breast cancer, right?
Okay.
So they're in a lower risk category, but that doesn't mean they should be overlooked. And men do get breast cancer. We see it frequently at my practice.
Wow.
So the thing for men is really to know your body, just everything about your body, just like it is for women. So breast self-exam can be a great tool for men because they can find a lump that way, but also it kind of makes them in control of their own health, just like it does for us women. So if they do self-exams and they find something, that's the only way that they're being screened. Whereas women, insurance pays for a regular annual screening every year after the age of 40. For men, they don't have that ability. So the only way for a man to screen themselves is to do self-exam.
Oh, wow. That's a very important detail right there, because I never even thought about the fact that insurance wouldn't even cover it.
No,
That's
the only way to
crazy.
cover a screening for a male is if they themselves have tested positive for breast cancer gene.
Wow.
That's insane to me.
Hmm.
That doesn't even seem right.
And you have patients who come into your practice, so I mean it happens. Yet
Oh,
it's
absolutely.
like, dang.
Wow.
Absolutely. And young men too.
Wow.
That's mind-blowing, actually. So, Megan, when I was in school for radiologic technology a million years ago, I I know mammography was one of the fields that intimidated me the most because of the discomfort level that it created for patients. I couldn't really understand at the time how something so important to women's health hadn't found a better way. And of course, we used to joke and say things like it was, manography, because it was obviously designed by a man back then for it to
And
not
you're
be
right.
comfortable.
You're right.
But
It was.
I couldn't understand, when we had such amazing technology at that time, like gamma knives for cancer treatment. So was that something that fueled your passion to get better technology in your hometown as well?
Well, there's actually a lot of factors to that, and I'll tell you about it. So, after the birth of my second child, I had a large breast lump at the age of 26. I reported my symptom, but it wasn't taken seriously because of my age. Just obtaining the script for mammography was difficult. I was told I was wasting their time. I wasn't 40 yet. It was a waste of their time to even worry with this. I self-advocated, got a mammogram, which was uncomfortable and left me sore and bruised. The lump was benign, and since it's actually had to be biopsied, um, I wasn't crazy, but they made me feel like I was eh, wasting their time, and that should
Yeah.
never happen. So that's part of
Ever.
it for me as
Yeah.
well. Because the patient knows their body, just like we spoke about, and you're the boss. Honestly, the patient is the boss. Healthcare workers are your employees. The only reason we go to work is to help you. So
I
if you
love
kind of
that.
keep that in mind, it's a very different conversation. Let's see.
That's crazy. So sidebar, I was asking her because I just had like a mammogram and all that stuff. So I've been reaching out to her, asking her all these questions, and she's been amazing. And I can't even remember what it was I said, or oh no, I said, so about the biopsy, and you're like, you're the boss. And I'm like, what?
Yeah.
And it was just like kind of mind baffling to me, because we forget sometimes that we are, in charge of our health. And because I mean, I have experience and have had doctors basically say, this is what we're going to do, or and shut you out or dismiss you. And it was crazy when he said that, when he said, oh, you're the boss. I was like, what? I just think that's so
but it's
cool.
true. It's
Yeah.
true, and it's part of self-advocating, so I always advise, tell a doctor if there's something that doesn't feel right to you, and if they won't listen, find another doctor.
We say
It's
that
just
all the
that
time,
simple.
Megan.
Amen.
We say
Yeah.
it's okay because you're the boss, you can fire your doctor.
Exactly.
And not to say there aren't amazing physicians out there. We always add that because I don't ever want anyone to think that we doctor bash, because we don't, because there are amazing physicians. But it's like the same thing with the, customer service. The customer's always right. The same thing goes for healthcare.
Absolutely. Absolutely. It's hard to get people to remember that, because we have such a culture of respecting doctors and not questioning their authority, but really
So
their
true.
authority only pertains to your health.
So true.
I love it.
So with all of
Girl.
that together, after after completing the X-ray tech courses in the regular radiography program at Eastern Florida State, I specialized in the mammography. There's a lot you have to do for that, and there are no programs that are local that are specific to mammography. So you have to find someone in the field who will allow you to do 40 hours of training and 25 exams with their signature on it, plus a lot of other things that you have to do before you can even sit for the federal registry. And that's part of why there's such a lack of mammography technologists, and they're so difficult to find. So all of those things together helped me choose this. But as far as not worrying about causing people discomfort, I have a little bit of different experience with that. I was a pediatric burn patient, and I stayed at the Shriners Burn Institute in Cincinnati as a child, so when I was 12, while having reconstruction and skin grafts, multiple surgeries there. And I think that experience really formed the bedside manner I display with patients who now are afraid of the exam, and in itself, the impact of the outcome of the exam on their lives. So it's not even just the concern about the pain at the time of mammography, or if there's going to be discomfort or having to reveal your body in that way, but also the impact of what happens after the exam, especially for women with symptoms or problems or previous history of cancer.
It's so true.
Wow.
When I was a student, that was definitely my mindset. And once I actually got into the field, they say didactic versus clinical is so different. And I can't agree more with what you just said, because once I got into the field and I saw that momentary discomfort was for the betterment, like of, the outcome is to get that particular picture, or, because the best that you can do as a photographer is get the best picture so that diagnostically the doctor can do their job. And so it's so true.
Yep, and that's exactly what radiology is. It's all about being a photographer, just of people's insides, not their outsides.
I love
Absolutely.
it. Could you actually explain the difference of, like, for diagnostic with the mammogram versus ultrasound and MRI?
Sure. So, and that kind of goes
so
into
many.
Yeah, absolutely. Mammography, ultrasound, and MRI work together like partners solving a case. So they're all used in conjunction to diagnose breast issues. Most breast lumps are benign origin, but we don't stop at probably. We look for definite answers, because it's what you deserve as the patient. If the abnormality persists, then we go to biopsy if it cannot be definitely identified as benign. So mammography is step one. Screening mammography is covered for every woman after the age of 40, and there's a federal act that keeps that as part of our healthcare. It doesn't matter which insurance you have. It's always covered 100% every year after the age of 40. So that's your regular screening mammography. And I like to kind of describe that as like Google Earth. So that's how you see the whole state of Florida. You see that I-4 still goes the same way. There's no huge sinkhole that all of Orlando has fallen into. It's like your basic breast fingerprint. So what we do every year is we take your fingerprint from one year, your fingerprint from the next year, we compare the two, no changes, have a nice year. That's screening mammography. So that's how that works. And that's why mammography is the major tool that's used. Now, if you have an abnormality, such as a palpable lump, then we're definitely going to use ultrasound as well. Ultrasound's more like street view. So with Street View on Google Earth, you can zoom into that area and see what color the house is. Ultrasound's not good by itself most of the time because if you only know what color the house is, you don't know what county it's in. So that's why those two things work very well together. So those are both based on the density of breast tissues and what it's actually made of, because in ultrasound, you can tell the difference between fluid and solid things within the breast.
Masses, yeah.
So, yeah. So that's why ultrasound's so wonderful. MRI is like step 3. So MRI is a completely different technology because it uses the actual cellular identity of each cell in the imaging, and that cellular identity makes up this picture. So it's a whole different technology.
Wow. And I love how you explain that with the street view, and that's cool.
Just something to make it a little bit more relatable and a little less abstract.
Yeah.
It's a girl after my own heart. I love analogies because it helps my brain understand things so much better.
Yeah, mine too. But if that doesn't work, we'll try another one.
Yeah, I love it.
That was great. So what if a lump is found? What do we do next? When do we worry? And like I said earlier, I know I've been dealing with some breast stuff myself, and you've helped me out and kept me calm with all this information. So I'd love to share some of the suggestions you've given me with the importance of following up and what comes next, so that others can feel prepared should they ever find themselves in a scary breast situation.
Got it. So when you find a lump during self-breast exam, or if your physician feels one during annual clinical examination, the next step is imaging, period. So just like we spoke about, mammography is a wonderful tool, but if there's a palpable thing, ultrasound is almost always used with mammography. So they work together. After that, if it's determined to be benign, then you may still, just based upon clinical concerns, some doctors will choose to biopsy anyway. Biopsy is the only way that you can really tell what something is made of in the end. So if it looks like it's possibly suspicious, or if there's a clinical reason to do so, perhaps your doctor knows that you have major family history or that you have other physical things going on with your health, then that might be a reason to biopsy just by itself. The important thing is, even if you get to biopsy, to know that most breast biopsies are negative. Approximately 80% of all breast biopsies are negative. So even if you have a lump, even if the imaging says you should have a biopsy, even if you have a biopsy, still 20% of those are the ones that are positive. So to sit around and cause yourself stress and anxiety until you have your answer isn't always the most helpful thing. Use your stress and anxiety to push yourself to continue to advocate for yourself and continue to do all the things that you need to do instead, which is my best advice.
Yeah, so get the biopsy, have that peace of mind, because like you said, it's just, that's a scary thing. And, we have enough stress in our life, and that's the last thing we need to add to it. So I agree. I think that's a great point.
Absolutely. And that's why we send people to breast surgeons, because they're so used to dealing with this, and it's a specialist who can really take into account all of your personal feelings and family history and personal history without just the radiologist who's never met you, who's only read your images. And so using a team of doctors and putting all of that together is how we really get a really good circle of care for a person.
Such great advice. I love that you also talk about, really having that conversation. So instead of necessarily going to Dr. Google and freaking yourself out,
right.
that it really starts with having that first conversation with whatever doctor. I mean, I know for women, a lot of times it's our OBGYN or GYN. So, but being able to feel comfortable enough to be able to say something feels off, I want to come in and get it checked out.
Yes, and that's why I'm so big on our teenage daughters and sons being talked to about this while they're still at home. Because if you open the conversation about something that's uncomfortable with a parent, then they're more likely when they go to college or later in adult life to talk to another person of authority about such personal things. So it's kind of setting up a culture of openness as well.
I love that. And it's also
That's a
being
good
in tune
point.
with your body. Yeah.
Absolutely. Hmm.
I love
Yeah,
it.
that's a really good thing to teach the children. It really is, because
Yeah.
I mean, if you think about, I'm sure all of us growing up, it's like things are awkward. You don't look, you don't, it's just like, I don't know. I feel like it's a great thing to do is to start them young to like be comfortable with their bodies, know their bodies and what to look for. So that's
Yes.
a great point.
Yeah, so something I have done and have suggested to other people is just taking like a little how to do a breast self-exam card and leaving it in the bathroom. And then, what is this? Oh, I'll tell you all about that, honey. Any little way to get in there
Oh.
is positive.
So, Megan, I have a quick question, which I know we didn't really probably discuss beforehand, but is this something that's included in sex education now with our children? Do you know?
Ooh, good
I
question.
don't know. I don't know. I have done some speeches for the health department for at-risk subsects of teenagers,
Mm-hmm.
and they all did not seem like they had any knowledge of it.
That's
Wow.
something that maybe we could look into here in our county, because Misty and I are always looking for ways that we can kind of get a conversation started, which is part of the reason that we, started this podcast, because there's so many people advocating. And I just feel like if we can get more attention there, then we can obviously bring stuff into the light. And that, I feel like if you say so much of that happens, when bodies are changing, and it seems like girls are going through and boys going through the change a little earlier for girls, a little later for boys now with all the hormonal disruptions that we have,
Yes.
that would be a big topic to include, right?
Yes, absolutely.
Yeah,
we need
that's a
we need
good
to
point.
we need to look into that, ladies.
Yes,
All right.
everyone, all the schools. And then, not just here in Brevard County where we're from, but all over. That would be a
Yeah.
really great question to ask. Definitely look into
Yes,
that.
because nobody's going on TikTok to look up how to do a breast self-exam.
Yeah. And the
You
and the
know,
internet is overwhelming with
TikTok.
information. I
it
I
is.
love I love researching. but at some point, I probably wasn't even until my 20s when I was like, all right, how do I even do this? Like, do I put my arm
Right.
behind my head? Do I keep my arm down? Like, what am I doing?
Yes.
Yeah,
So
tell us how to do it. Good point.
well, it's different for everybody. And
Okay.
you have to figure out what your pattern and your routine is. And that's why those little cards are so helpful. The ones that I've handed out previously and distributed at different events were like bilingual, so Spanish on one side, English on the other side, has a little pictograph of the pattern that you should do and little punch outs. So you punch out when you've done it every month. Because the other
Oh,
important thing is
cool.
trying to do it at the same time during your cycle. So you want to
Mhm.
do breast self-exam 1 week your cycle, because that's when the breasts are most calm. They're not inflamed from the hormone influence of ovulation. So if you do it at the same time every month in the same pattern, then it just becomes second nature. So it's just getting that started. And then it's so easy. A lot of my patients just do it in the shower because that's when
Mhm.
it's easy for them and they don't feel like anyone's watching them. It's a private time and private space, but as long as you're doing the same thing, you're going to find those changes.
That's
Do you have
awesome.
a digital version of do you have a digital version of the card that you're talking about that we can maybe perhaps upload on our blog for others to
I
see?
don't, but I bet we could work together and find one or create a new one.
Yeah. Okay, let's
The
Yes.
do
one I had
it.
was from Susan G. Komen Foundation,
Okay.
so we could probably go there and find one to use.
Yes. All right, sounds
Awesome.
good.
I love it. I have another sidebar question too. With regards to, have you noticed, obviously we talk about a lot of hormonal issues with autoimmune, but have you noticed, statistically speaking, women that maybe suffer from things like PCOS or those type of hormone fluctuations, do they tend to have a higher rate for fibrotic breasts, or is there not really?
There's absolutely hormonal correlation to the density of breasts. So our breasts are most fibrous and dense when we are younger, because that's when you have your highest amounts of hormones. Your breasts are amped up for reproduction and for the job that they were put there to do. So your breasts are definitely more dense, more fibrous when you're young because of your hormones. But also, if you have hormonal imbalances, that can cause cystic issues, fibrous issues, dense breasts. It's also familial. So there's so many different pieces that go into that puzzle that it's hard to say that one particular thing is at the root cause for having dense breasts or fibrous breasts. But they used to call it fibrocystic breast disease. It's no longer considered a disease. It's just fibrocystic breasts. It's just someone's normal. Now that can change if you're, for example, if you start hormone replacement therapy, you can see an increase in the density of breasts, which is part of the reason that we ask those questions. Breast cancers, ovarian cancers, uterine cancers, cervical cancers, they all feed on hormones. So anytime that we have an excess of hormones, you're going to have an enhanced possibility of having some type of situation happen. So that is why we do ask about hormone replacement specifically.
Yes, and actually, I know this too, just because my epidemiology homework, I had mentioned that a study that I looked which showed that the risk of breast cancer was higher among women who currently or recently use contemporary hormonal contraceptives than among women who have never used hormonal contraceptives. And that was a study in 2017 with the last name of March.
Interesting.
I thought that was interesting. I was like, I got to find that real quick.
Yes.
Yeah.
And there are a lot of studies that say very similar things. What we always say about that is it's just the risk versus benefit,
Yeah.
So almost all healthcare and decisions to take medications are risk versus benefit analysis. So, is the benefit of hormonal birth control greater than the risk of breast cancer? Maybe that's the real question.
Yeah.
And there, like you say, it's such an individual thing because there's so much that goes into that, like familial history and like all those other things that you said. So
Absolutely.
Megan, you have given us so much information that is like blowing my mind right now.
Oh,
Stuff
yay. I live for that.
Stuff I haven't given thought to, and you think I would because I'm a woman, but I love when things that, and I think that's one of the things about breast cancer, which is why we tend to overlook it still, because it's almost like the cancer that, at least it was when I worked in oncology, where it's like, oh, okay, breast cancer, it's kind of the bread and butter, like for men with prostate. So I don't think that it gets, because it got so much attention, I don't think it gets the actual like smaller attention that it deserves, the attention to detail, if that makes sense.
Right. And I think maybe the question there is why?
Right.
Why not?
Yeah.
And perhaps because it's treatable, but perhaps because your breasts are removable, and if you have brain cancer, it's not always as easy. But the big deal for us is early detection. Detection. And that is why insurance pays for a screening mammogram, but they don't pay for a screening head CT for brain cancer. Because if we can find and identify breast cancer at an early stage, we can correct it, we can treat it without really changing the course of your lifetime. And that's a big deal.
That's a huge deal, because like you say, when you can get ahead of something, you change the whole course.
Absolutely. There's also been a lot of time and money put into breast cancer research, fortunately, because of a lot of the fundraising events and the Susan G. Komen Foundation and so many breast walks that, we've all participated in. They really do make a difference. And that's why there are so many therapies available. And there are a lot of different breast cancers that behave differently. So we need different therapies to treat those specific situations. And you need specialists that know about those therapies. So, it really does take a village.
Yeah, and studies to find the links and more research, all of that stuff is so valuable and important. Which
Absolutely,
is why
on a global scale.
October is also Breast Cancer Awareness Month, so we thought that this would be a perfect time to have this discussion so we could remind everybody, to do their self-checks and to educate themselves and to, learn their body so that they can keep an eye out for any changes.
Absolutely.
Yep. I love these awareness months, but I also like to remind people that you have breasts every month of the year. So yeah, it's important to check them, like she said, every month.
Every month.
So I love that. Meghan, do you have any last words of wisdom to share with everybody, since you are now my breast expert?
Well, yes, a couple things. So just like we spoke about, know your body, come for annual screenings. It's paid for. Tell doctors when you have concerns and don't stop if you aren't being heard or if you feel you aren't being heard. At my breast center in Melbourne, we conduct low dose 3D comfort mammography. So let me break that down. The comfort is it's due to our smart curve system. So traditional mammography equipment is flat, and this is breast shaped. So, you definitely know females are in the engineering field now because we have breast-shaped mammography equipment. They're on two
Love
of these in
it.
Brevard.
I'm
Yes,
clapping.
yes, yes. So we have one at our center in Melbourne, and then there's one at the Stewart Medical Center in Rockledge. So those are the two that are available in Brevard, but anyone can search it by just going online and looking for hologic comfort or smart curve mammography. So if you look for smart curve, you can find that anywhere worldwide, somewhere that's close to you. This should take out a lot of the fear of discomfort for mammography, and we found that it makes a huge difference, especially in post-surgical patients, in the comfort with the mammography exam. I pride myself on painless examinations and make sure to let the patient know that they are always in control of the examination, that I will never do anything that is against their wishes, and that if they have even the slightest bit of discomfort, to just let us know so we can fix that. So don't be afraid to come in. You are in control and you can stop the exam at any time. But let me say, in 10 years and 35,000 mammograms, it hasn't happened.
Wow.
That's
So
amazing.
Cool.
yeah, kindness goes a long way. And if you don't feel like you're being treated appropriately, go somewhere else. It's just that easy.
Absolutely.
100%. The technologist makes all the difference.
Yeah, I think so. But
I mean, the
3D
technology is great.
mammography, exactly. And that's what the other thing I wanted to talk about is 3D mammography. It is a huge deal. This is an amazing tool, especially for younger women or women with dense fibrous breast tissue, those with a history of prior breast surgery, and to evaluate any abnormalities. All of these are reasons that I'm such a protagonist for this technology. Insurance pays for 3D mammography, and you can find a local provider, just like we spoke about searching online. So what you're looking for is a low dose 3D mammogram. It's a big deal. So as an x-ray tech, you know the difference, and most people have seen a chest x-ray. It's a singular image. So a three-dimensional object on a singular plane of view is what we see when we see a chest x-ray. You can see the lungs, you can see the outline of the heart. Now think about a CT or an MRI where you have slices. That's the difference between 2D and 3D mammography. However, the radiation dose can be as low or lower than traditional mammography when you find a low dose 3D provider. It's still zero
That
copay. And it's a huge, huge difference in the ability to find very small sub-centimeter abnormalities, the type that we want to catch so we can do early detection and treatment without changing the course of someone's life.
that's incredible.
Thank you.
I
Thank
mean,
you.
I mean, I just can't believe how far technology's come just even since I was in school, because like I said, I mean, mammography was still very much 2D and very painful, and it definitely, I mean, I was a trauma junkie anyway, so I tended to stick to the ER and OR, but
Mm.
I definitely admired people that were able to go into mammography just because of the fact that it's so important. It's so important.
And it's personal. And if you can so I always look at it like this: if I can get one woman to come in for a painless exam she calls her cousin and tells her about it, and her cousin tells her friend, and her friend tells her other two friends over lunch that they all had painless mammo, then it becomes more of a culture of this is a normal, safe, easy thing to do. And if we can go get our hair done every few months, we can certainly go in once a year for a free health check, especially if we know it's not going to be painful, it's not going to be uncomfortable, it'll be private. So if you give one person one good experience, I feel like it has an exponential effect. So
Absolutely.
that's where I'm at.
Well, and the more
love it.
proactive you can be, I love how much you are talking about being proactive with your health, because there's so much that we are reactive to, that the things that we can be proactive on make all the difference a lot of times. So that's
Absolutely.
incredible.
And if you don't come in, we can't help you.
I love that.
True. Very true.
I love it. Well, tell everybody how they can find you, because I'm sure they're going to probably want to blow you up asking you questions. So tell our listeners how they can find you.
Okay, well, I'm at TPAS, that's TEPAS Breast Center in Melbourne. You can call us anytime at 321-312-4178. You can also schedule appointments online at tpasbreastcenter.com, and I'm sure you guys can probably include a link somewhere for people. But like we talked about, it's covered 100% every year for every woman after the age of 40. You can usually, with most insurances, come in once at the age of 35 and have your baseline done. We would love to see you at our center, but the big thing is just get in somewhere.
Thank you.
Megan,
All right.
I'm like blown away over here.
Yay! And yeah, if you have questions, there's always somebody to ask. And if you can't find someone, please, please, please call us. We would be happy to help you. We help from the screening process to diagnosis and beyond. So
And even
that's
just
what we do.
answering questions, like sometimes, that's important too. And I love that you guys, can offer that as well, giving people the peace of mind, answering questions, and then go from there.
Right. Well, and TPAS is very special because TPAS Healthcare, which is under our large umbrella, we have an actual breast surgeon in-house. So you have a specialized radiologist, you have a breast surgeon, and you have the technologist to take the pictures. But realistically, all I am is your photographer. I can be your photographer and I can be your friend, but I can't be your doctor. So putting that medical professional into the circle of care is a huge deal because they're the ones that can really help you make decisions.
That is
Thank
amazing.
you so much for joining us today. And
My pleasure.
everything will be available on our website and links and all that good stuff. So thank you so much again.
No,
Thank you.
Thank you for spreading the knowledge and helping the people to get out there and get in.
Thank you guys for listening, and as always, we ask that you leave us a 5-star review on whatever platform you're listening to.
Also, make sure you are following us on Instagram and Facebook for the latest updates, and subscribe to our website where you'll find all the details from today's podcast as well as other amazing resources. Don't forget to check out our latest issue of the Invisible Diaries magazine.
We hope you enjoyed this episode, and if you want to share your story or be featured as a Spoonie Spotlight, you can apply on our website, theinvisiblediaries.com. Bye!